Hi, everyone. Thanks for joining me today. Bart Baldwin is going to join us today. He has over 2 decades of experience in public policy, lobbying, and executive level management in the healthcare and human services fields. And he's going to provide us some insight on some public policy decisions, state funding, and how he's providing support to those in the autism community. It's not the most fun topic, I know, but his experience, I believe, will open your eyes. And as always, if you enjoy our podcast, please rate and review us wherever you listen to podcasts and share with a friend. That's how we make our voice stronger. Thanks for listening. Welcome to my Autism Tribe, a community of advocates that are linked by autism but bound by strength. This is a time to find our sounding board and shoulders that help us carry life's load without the fear of criticism. We give and receive. We nurture and empower. I'm your host, Susan Scott. As we all know far too well, at least for our listeners in the United States, health insurance can be really complicated. Many of us have spent so many hours trying to connect the dots with insurance coverage. It's absolutely so stressful, and I personally have cried so many times to strangers on the other end of the phone just trying to make sense of it all. The insurance landscape has changed drastically over the years, and the good news is, as hard as it may seem some days, we have made some progress. As an example, at least 200 million people now have health insurance coverage for ABA because of the tireless efforts and dedication of advocates across the country. One of these advocates is Bart Baldwin. He's a longtime state lobbyist in the state of Kentucky, and his efforts in advocacy have protected the rights, services, and supports of our autism community. Previously, Bart served as the president of the Children's Alliance, representing child welfare agencies in Kentucky, and he was also the national director of regional public policy for the Washington D.C. based Child Welfare League of America. Again, I understand this is not the most interesting or fun topic. Bart's really going to love this lead in, I know, but I can assure you, in my conversations with Bart, he has opened my eyes to just how much hard work is being done behind the scenes that most of us are completely unaware of. Let's welcome Bart Baldwin. Bart, thanks so much for joining us today. And I know that this topic isn't probably the most fun topic for everyone, but when we were speaking earlier this week, face to face, I, of course, had a lot of questions for you, being a state lobbyist in the state of Kentucky. And you shed so much really cool information on what goes on behind the scenes that I knew that our listeners would really appreciate the information as well. So thanks for joining us.
Absolutely. Happy to be here.
So health insurance is a beast. And I know all of our listeners have been navigating all of the complexities of it. And you have a background where you have spent a lot of time advocating to protect the rights, services, and supports of the autism community. So I do want to touch and let our listeners know a little bit about the work that you've done behind the scenes. So how did you get into the autism community advocacy?
Sure. Basically, I've been lobbying for about 22 years and primarily focused on children's services, foster care agencies, and that type of thing. And I was running an association, and one of our members who did services for children with autism asked me to meet with a group of parents that were trying to get a bill passed. And I did. A few weeks later, I was happy to talk with them and tell them about lobbying and advocacy and what to do in the state capitol. And several weeks later, there were a couple of moms of had sons with autism walking the halls of the Senate trying to get a bill passed. And so, long story short, they hooked me in. Their passion, their stories, the struggles they've had, and how important this was to them really kind of looped me in. And I became an instant advocate on their behalf and have continued that for over 10 years now. And so that's kind of how I got involved with it. It eventually turned into a contract for me with Autism Speaks at the national level to work at the state level. And I currently have a group of ABA providers in Kentucky that I work with, many of which I met during the time of working on our autism mandate legislation. And so that's kind of how I got involved with it and continued to work. And really, it's been one of the highlights of my career.
That's incredible. I love the fact that there were two autism moms walking the Senate, for just really trying to get a bill passed, because I think that's where a lot of the stories start off, is that you have these autism parents or these autism caregivers that aren't getting the support that they need. So they start somewhere, and sometimes it's like we don't necessarily have a plan. We just know that something has to be done, and to have people like you that are helping us get the bills passed, to provide us the support that we need and the services that we need, is absolutely critical. And so thank you so much for helping those two women out, and then now just continuing it on, because we're far from where we need to be, but we have made so much progress because of people like you.
Thank you.
So you mentioned, okay, we've got the state mandate, and a lot of states now do have a mandate. Can you share the process of how that came to be, and really what all was involved in that, to really just show people how much work and effort it actually took to get to where we are today?
Absolutely. I mean, when I first got involved, I have a healthcare background, and I was just dumbfounded when they shared with me that, well, we have health insurance, we have commercial health insurance, we pay our premiums. We're not asking for something, government assistance or some kind of special program. We just found out that our child was at one point, previously in their lives, but our child was diagnosed with autism, and we turned to our insurance company and they said, no, we don't cover services for children with autism. Like, what? I mean, that is completely blatantly discriminatory. I mean, how is that allowed?
Right.
But it was standard. It was common, and still is in some cases. And so that was the genesis of, state mandates. For insurance companies, that level of insurance is regulated at the state level for small group, large group, individual group policies. And so Autism Speaks started the effort back in 06 and 07 in South Carolina with Laura Unum, and with passing a state insurance mandate to require insurance companies to provide coverage for children with autism. And so that was the beginning of it. Kentucky, we passed our first one in 2010, and they're now up to all 50 states as of just a few weeks ago, frankly. Tennessee was the last one to come on board. And this has been since 07, so that's how long it's taken to go state by state and get that done, and been really excited to be a part of that. We passed our mandate in 2010. We came back in 2018 and revised it because our original one had some age limits and some dollar caps, depending on how old your child was and what kind of plan you had. And we felt that was still discriminatory against, child with autism and their family, and it had no bearing whatsoever on the medical necessity or the treatment plan or the needs of the child. So just arbitrary numbers. And so we were successful in getting that changed so that our mandate in Kentucky now has no limits or dollar caps whatsoever. I was really proud of that. And to your point, I'm making that sound much simpler than it was.
I know. I'm sure.
So, and this is the role, I guess, that I felt I've played. I mean, referencing back to the start of this with those two moms, they lived it. They know it. They understand it. But they didn't know how to get a bill passed. Why would they? But that's what I do. That's what I know, and that's the process of who to talk to and when. And so I really felt that I could help navigate them and other providers. It wasn't just those two. There was lots of other family members, parents that across the state would come down to hearings and that type of thing and contact their legislators, call and support House Bill 159. I mean, that grassroots effort is critical. A story that real quickly was walking into a senator's office with these two fine ladies, and a senator I knew, a lady from Lexington, and she so I say hello to her and introduced who was with me. She's like, "Oh, good, the real people. Thank goodness to see you." So, I was like, I appreciate that. I'm not sure what that makes me, but okay.
Yeah, exactly.
But I mean, obviously, the point is she sees me. I'm down there. That's what I do. But she wanted to hear from the parents and the families that are living this day to day, and I can't underestimate that.
Absolutely.
That aspect of all this. I mean, it's great, to have somebody shepherding the steer, navigating the waters as I did on behalf of the group, but I can't underestimate the importance of families with children with autism knowing their legislator, calling their legislator, making their voices heard. Because it's a totally different discussion when we went in, sat down. Whenever I sit down with the legislator on a particular issue and I explain what we're working on, and if they've heard from constituents back home, it is a quick conversation. It's much easier. They're like, yes, I've heard from folks back in my district about this, and I want to help. Versus me just trying to, leverage a relationship I have and convince them with the facts or the data or whatever. All that kind of stuff, is important. But the most important is that they've heard from one of their constituents.
Yeah.
Or multiple, and the more the better. So that's been a part of the process. We really utilized that back in 2010. Not so much in 2018. We did because we had a lot of support from the legislature, thankfully, and we didn't utilize it as much the second go around. But we were able to get both bills passed without any no votes in the House or Senate on that bill. And one of the things that I think helps, it's an odd way to say it, but it helps this cause is, from a public policy perspective, is especially now, and it was even true in 2009 and 2010, it's hard to meet anybody that doesn't have a family member or know somebody, a close friend that has a child or a young or even adult with autism in their family. And so, that first Senate committee meeting we went to back in 2009, there were 9 members on the committee, and 4 of them had a child or grandchild with autism. And so that's a whole different discussion.
Yeah.
And that's really what I think helped us overcome and have success, because there's lots of groups out there that oppose any kind of insurance mandate, regardless of the topic. It's not about autism. It's just they don't want any more insurance mandates because it drives up costs for health insurance, which is, as you know, is a huge issue.
Sure.
In our country, from the small business perspective, from individual families' perspectives, everybody complains, and I'm one of them, about my cost of my health insurance. Believe me.
Yeah.
It continues to go up, and my benefits continue to go down.
Right.
But regardless of that, we can't allow insurance companies to discriminate blatantly against children with autism and their families.
Absolutely. And when we were speaking earlier, it's just like any other kind of diagnosis. It's, if a child or an individual calls up and submits something to the insurance company because they have cancer, or if they have diabetes, like, even though the insurance company may still be a little hesitant on paying, their portion of some of the bills, it's a lot easier. And that's just really kind of a sad thing when someone is handing you a piece of paper saying, I have a diagnosis, my child needs help and needs the support. And when it's just is ignored. And that's really just sad. So that's a huge, huge thing.
Yeah, and I use that as part of my argument when talking with legislators. I personally have a niece who's getting ready to turn 16, and the picture of health. But she was 6 weeks old. She was diagnosed with leukemia, and went through a couple rounds of chemotherapy. Ended up having to get a bone marrow transplant, and her health and future was. I mean, it was at risk for a long time there, very early in her life, and through a lot of prayer and a lot of great services from the medical community. She fought through it, and she's, like I said, she's picture health now these days, and has been for a long time. But nobody. I mean, it didn't matter. She didn't have dollar caps, and she didn't have an age limit. I mean, if you're 6 today and your benefits X number of dollars, you turn 7 tomorrow, it's going to drop off to a fifth of that. Well, that has nothing to do with your medical needs or the treatment plan.
Right.
And so, it just doesn't make any sense, and I think it's just a practice that came into being. I have no idea how it was ever allowed, but we do have, at least in the states, a mandate in all 50 states at this point. And I tell you what, a lot of groups learn is once you get the mandate, it's not over.
Yeah. Yep.
You've got to enforce it. You still got to deal with the implementation of it. You still have to hold insurance companies, accountable. And that's a lot of what we work on now with my group of ABA providers is dealing with the health insurance companies to be sure that they have adequate networks and availability of services, and pay for services that the child needs. I mean, health insurance, you're always dealing with prior authorizations and necessity and all those things that everybody deals with on every diagnosis or every treatment. But we shouldn't be singling out autism.
And this is kind of a great, segue into, okay, so we have the mandates. Now a larger issue that has come up, and most recently with the Anthem insurance company, is that, you have the rates that these insurance companies are saying that they will pay to the providers of the services. And this has kind of been an ongoing battle because, as we know, we need these providers to have the services for our loved ones. And if the rates are so low for the providers that they can't adequately staff these therapy centers or the services that they're providing, then some of them will most likely go under, which is the exact opposite of what we need. We need more of them. So can you speak a little bit on what you guys are doing in working with these insurance companies and just the legislation on what's being done?
Sure. That's one of the ongoing implementation and challenges of, even if you have a mandate, you're not done at that point. I think early on, folks say, "Oh, we got the bill passed, we're done." But there's ongoing diligence, and this is a great example of working with insurance companies and Department of Insurance or whomever we need to be sure that they have an adequate network. Insurance companies on all types of services. There's state law and requirements to have network adequacy. So essentially saying that if my members that are with Anthem or any other commercial plan needs this service, that they have in network an adequate supply of those provider types. I mean, for most families, you're talking about your primary care physician or your if you have a particular issue, your cardiologist or whatever it might be, that everybody's kind of normally looked at who's in network with this insurance company, and is there someone close by or within a reasonable time frame for me to get to for that primary care or that specialist or physical therapy or whatever it may be.
Sure.
And it's the same for ABA, which is, as you know, that primarily outside of some of those other issues with our services with PTO, tutor speech or nutritionist and that type of thing. But, the autism, it's mostly from ABA. And so there's no different requirement for insurance companies that they have an adequate and available network. And ultimately that a lot of times comes down to what they pay for the service.
Right.
And negotiating with that provider, because to say it's a very specialized service. Folks that deliver that service require training and licensure in many states. You have to have additional license, and so there's a cost associated with that. Like any business, there's costs associated with staffing and having the right credentialed and trained staff available. And rates aren't covering that cost. It's really hard to build that network, and so. That's kind of where we are currently. We're working with that issue in Kentucky, but I know other states are with that, and I'm sure every state at some level with one insurance company or another are facing those issues. But that's something that is working on behalf of my client. It's a group of providers. That's working with that issue in terms of coding and the rates, as well as with the state Medicaid program on those issues as well.
Right. I've had several different conversations, not at a granular level, because believe me, I really don't want to get granular with it. But my son's ABA provider, they the administrative portion of it, you think, oh, these providers, they provide therapy. But what really goes on is there is so much time that they spend with insurance companies really fighting for coverage for your child and really working with them on the rates or just, just coverage, period. And so their job's not done after they see your child. They have to go back to their computers and the phone and make countless, endless phone calls and emails with these people. So I think that's important to know. And a lot of people may already know it, but it's definitely important to point out.
Well, and I think that particular aspect of it is the same struggles of that provider type as you see as your primary care doc. Why are so many of you don't see hometown doctors and two doctors in can practice together anymore. That's a rarity. They're all part of hospital systems or healthcare systems that have been bought up, and that that's kind of the crux of it. They can't you can't. It's hard to do that as a smaller provider, spend that much time and not have the kind of resources to have scale, to have that's
right.
why to be able to, if you're one or two docs, and it's really hard to spend that much time and still provide good services to your patients. And so that's that's just part of where we are, at least in this country, in terms of health insurance and what it takes and the extra time and effort it takes just to get paid after you've delivered the service.
Sure.
And I think we're not going to fix that problem around ABA because it's much more systemic than just this particular therapy. But what we can advocate for is that there's not blatant additional barriers put on and additional limits or caps or those types of things put on services for children with autism beyond just the normal health insurance claims and billing processes.
Absolutely. Yeah, that's a great point. I just want to, because you were kind of sharing some information, and I'll provide your contact information in the show notes. But when I was looking at some of the information on, what exactly does Bart do? He's a state lobbyist, but what does that really mean? And this is just my ignorance. But when someone says like lobbying, direct lobbying to key decision makers, the number, okay, you've got, and I'm just reading a bullet point list. So General Assembly, the Governor's Office, Cabinet for Health and Family Services, Department for Medicaid Services, Department for Behavioral Health, Developmental and Intellectual Disabilities, Department of Education, and the Medicaid Managed Care Organizations. That's a lot of lobbying. That's a lot of work. And so it just really surprised me, not saying that I know there's a lot of work to be done, but to have that many points of contact is really just mind-boggling.
You're making me feel better. I feel that on a daily basis. But, the process of lobbying, and I think that I'll have to do a shout out for my profession, that most people, if they know what it is at all, it's one of those things that tends to have oftentimes a negative connotation from scandals or lobbyists or, Jack Abramoff, was a big thing at the federal level, and flying legislators to the Caribbean for, dinners and weekend trips and all that. And
sure.
I mean, I may go on in D.C., but I say it doesn't go on, frankly, in Kentucky.
Yeah.
I don't do any of that. Zero.
Right.
We have, a very strict ethics law in Kentucky as far as paying or buying anything for a legislator. And it really, the lobbying role, it's in a lot of ways, it's a combination of relationships and brokering and having those relationships and understanding how all these decisions are made and how a bill becomes a law or how regulations are passed in the various departments, what the policies are. So it's really a lot to keep up with that. And the service itself to my clients is really just helping them, not only helping them navigate all of that, but just being the expert on how to get things done. I mean, a lot of times the decision makers are the legislators or the commissioners in those departments. So I'm not the decision maker. My job is to influence those decision makers my clients.
Right.
I tell a lot of folks that a lobbyist is, if you're running a business and you interact, either you're contract with government or you're regulated by government in one way or another, it's a similar role that you would have for your attorney or your CPA.
Sure.
If you're going to court, you're going to take your attorney with you.
Mm-hmm.
Because they know how the court works and the processes and filings and briefs and all that type of thing. That's what they do. If you're getting audited by the IRS or you're filing your taxes, you want your CPA because that's what they're trained and knowledgeable in. And so if you're interacting with government, executive branch or legislative branch, either way, then a lobbyist kind of plays that role where you're advocate with those decision makers, but we're also helping you navigate.
Just kind of connect all of the dots.
Connect all the dots, right? And the strategy, and that comes down to what's the best strategy, what's the best message, given all that.
Mm-hmm.
Where's the opportunity? Where can whatever we're advocating for line up with a priority for a legislator or a priority for a particular department? How can we find that synergy?
Mm-hmm.
And so we can try to move things forward. So, and the big difference between lobbying and those other two professions I mentioned is the courts and legal and attorneys are all very clear guidelines and strict processes that you have to go through.
Mm-hmm.
Of course, CPAs and accounting has their own set of guidelines and IRS code and those types of things that you have to stay within.
Sure.
Lobbying doesn't. It doesn't have all that, and especially when you're dealing with the legislative process, it can change by the day.
Yeah.
It can change by the person. It depends on who's in charge and which party and which individual and what their personality is. And so it's very, very fluid. And that's the challenge to keep up with. Is it's very fluid in what your strategy was on something. I would give you a strategy today. 6 months from now, I may not give you that strategy. Same problem.
Sure.
Same issue, but the players change. The political environment changes. We've got a gubernatorial election coming up in a couple months in Kentucky, and whoever wins that race could change strategy on all kinds of things.
Absolutely.
So
it's like the stock market.
Yeah, exactly.
Do I buy or sell?
Yeah, my investment strategy today may not be what it is.
Yeah.
It was 6 months ago or 6 months from now. So,
mm-hmm.
So that's kind of the difference, and it's really just navigating all that.
It's incredible. Well, I'm glad you're doing it, and I'm not. That's just, I will advocate till I'm blue in the face, but having someone that can connect the dots and get in front of the decision makers is just wonderful. And I hope that we're able to continue to work together, as I'm advocating for the families and our individuals on the spectrum in the state of Kentucky specifically, just because that's where I am sitting, then I will do that. And absolutely just advocating for families all around the world, really, just in a very personal sense. And just wanted to give you a huge shout out because what you're doing, even though the word lobbyist sometimes does, like you said, doesn't have the best connotation, or lawyer, there are always those people that you want to have in your hip pocket because, and I can speak because I know you personally now, you are just a really great human being and your heart is in definitely the right place. So keep up the great work. And I'm really so fortunate to have you as part of my autism tribe.
Thank you very much. I appreciate it. Thank you so much for the work you're doing. Ultimately, it's you and your family and the families you work with is what inspires you, and that's what inspires me as well. I don't do this for some, to push some political or partisan or party line. It's always been about just helping folks, and what's a good policy, what's going to help, and that's what motivates me. And like I said, those two moms hooked me in, hook, line, and sinker. I'm still there.
We have a way of doing that.
Absolutely. There's been many since then, but you're right. That's special talent you all have.
Well, thanks for putting up with us.
You're welcome.
All right. Thank you so much, Bart. I've had many people reach out to me and ask which health insurance provides the best coverage, and I don't even know where to start because honestly, there's so many things that can affect coverage based on the specific type of insurance your employer carries, to what state you live in, and the list literally goes on and on. Just know that there are people there that can assist you in the navigation of it all, and they are fighting to protect your family. I always say, keep the hustle and don't take no for an answer. Progress has been made because of the people that didn't stop, that didn't accept no as an answer. We're all in it together. Thanks for being a part of my autism tribe, and I'll see you next week.